Hi, I'm Dr. Tan, a doctor working in the polyclinic. The theme for this year's NHG World Diabetes Day is on embracing life with diabetes. This year, we have two individuals with diabetes to share with us how they are able to lead a fruitful life with diabetes under control. And we also have a caregiver who will share with us his journey as a caregiver for his father who has diabetes.
I was upset and in denial.
I was indifferent because I was not concerned about my health and physical appearance. At the time, I was also feeling down due to my mom's recent passing.
I was started on diabetic medications. I was also overweight then, so I knew that I had to reduce my weight. I tried walking 10,000 steps daily and did some moderate exercise, but I had not been able to bring my weight down. I then saw the dietitian and she found out that I do not eat enough vegetables. So I included more of those and whole grains in my meals. My mother does the cooking most of the time, so I got her support to cook more vegetables. I explained my medical condition to her and she supported me throughout.
The journey has been filled with ups and downs. I was motivated at first, but along the way I started questioning if this is worth the effort. This inconsistency also meant the improvement in my diabetes control was initially slower than I would have liked. Eventually I realized the will to change must come from within. I must take control of my life and keep going as I am doing this for my own good.
My role as a caregiver is to help manage my dad's health from the start of February 2020 after my dad's fall. We later learned that this was due to his improper management of his diabetes, leading to hypoglycemia episodes. I felt overwhelmed as this happened during the circuit breaker period and my siblings were not able to help as they stay apart. While I knew that my dad has diabetes in his 30s, I only had superficial knowledge of the condition and don't know how to manage it. So there were a lot of unknowns in this condition. Education, acceptance, and help from my siblings. Learning more about the disease also removed a lot of the stress which was caused by me being unsure on what to do. Secondly, discussing his condition and medications with the healthcare team. Lastly, using technology like continuous glucose monitoring to understand how meal patterns affect blood glucose.
Firstly is to accept the fact that I have diabetes, and secondly is to change my diet to have better diabetic control.
Having a healthy diet. Back then, I neglected eating better as eating was a source of comfort and one of the ways I had coped with feeling down.
Sometimes I feel tempted to eat the sweet stuff that are not suitable. However, I worked with my dietitian to eat lesser of it so that I do not feel deprived.
Yes, definitely. At that time, I was considered obese and I feared that I couldn't turn my life around. I was also impatient for big improvements to occur and found it hard to accept that progress tends to be gradual and does not happen overnight.
Having supportive family and friends, good doctors and dietitian, having exercises that I enjoy, and having time to rest.
My late mom also had diabetes and I did not want to be in the same situation as my mom. In the longer term, I do not want diabetes-related complications to hinder my activities in future.
Having diabetes does not mean that you cannot eat what you like, just that you need to eat well and in correct proportions. A balanced meal can also be delicious. We need to make a conscious choice on what we eat so that we can live well.
A healthy, balanced diet is crucial. Gradually and sustainable improvements can be made, such as reducing sweet drinks as the first step. Having diabetes is not the end of the world. You can improve and turn your life around. Do it for yourself and know you are not alone in this journey.
I think learning more about the disease is a good way to start and have frank conversations with the doctors involved. Also, find support from other family members, and it's important to make sure that you are still living your own life.
Hi everyone, I'm Dr. Moses Tan, the chairperson of NHG World Diabetes Day 2023. Welcome to the second part of the two-part series of our webinar for World Diabetes Day 2023. I hope that after last week's webinar, everyone had gained better knowledge on making wiser dietary choices as well as steps in doing simple exercises and foot care to manage diabetes. These webinars will be available on our NHG World Diabetes Day website for viewing after the session. For those who have just joined us today, we would like to welcome you to our annual event to raise awareness about diabetes and to share with everyone ways to better manage and live with diabetes. We will also be holding a physical exhibition at Toa Payoh South Community Club next Saturday, 4th November 2023 from 9 a.m. to 1 p.m. Our healthcare team will also be there to share tips with you on diabetes management. Today, our medical social worker and psychologist are here to share coping strategies when you feel overwhelmed when managing your diabetes, as well as our nurses and pharmacists to share what you can do when you are sick and ways to manage your diabetic medications. Now, let us hand over the time to our medical social worker.
Good day, everyone. Welcome to World Diabetes Day 2023. My name is Lin, the medical social worker. I have my colleague here with me, Hui Ting, who is a senior psychologist. In this webinar, we'll be sharing about how stress affects our responses, what are the available strategies that can help us to better manage our thoughts, reduce stress, and ways to cope. Many of us do agree with the double responsibility of work and home. Submitting our works on time, meeting deadlines, getting the bills to be paid on time, taking care of our parents and children can be stressful. Additionally, we have to be mindful of taking care of our health too, such as controlling our diet and taking medications. Feeling stress is a common emotion when we attempt to balance the demands of a busy lifestyle while trying to manage diabetes at the same time. Mental stress, which originates in our mind, can cause disruption to our body system, and which in the long run can cause a rise in our blood sugar level. The stress may also distract us from taking proper care of ourselves. This is dangerous because it may take us off track from controlling our diabetes as we become preoccupied with other issues. Furthermore, it can lead to unhealthy coping mechanisms such as overeating and drinking alcohol. Emotion affects how we think, behave, and respond to situations. Although emotions are natural and instinctive, they can sometimes be overwhelming. That's why we can all benefit from understanding and managing our emotions healthily. The common responses are emotional, cognitive, and physical. Let me share with you some of the examples. For the emotion responses, can be the feeling of sadness, despair, guilt, withdrawal, loss of motivation, or inability to feel pleasure. The cognitive responses can be confusion, difficulty concentrating, rumination, intrusive thoughts, or forgetfulness. The physical responses can be also loss of appetite, tearful, physical discomfort, fatigue, or sleep difficulty. Next, I will hand over to my colleague Hui Ting.
Thank you, Lynn. So today I'll be covering on psychological interventions or coping strategies that can help with the betterment of our mental health. The acceptance and commitment therapy, also known as ACT, is one of the several therapeutic approaches used in the context of psychology and mental health. ACT encourages individuals to accept their thoughts, emotions, and bodily sensations without any judgment, even when these experiences are distressing. ACT teaches acceptance as a way to reduce the struggle against these experiences and that these feelings are appropriate responses to certain situations. ACT also guides individuals in clarifying their core values, what truly matters to them, and aligning their actions with these values to help them lead a more meaningful and fulfilling life. Most of us spend majority of our time either thinking about events that had happened in the past, things that might happen in the future, or even the what-ifs that never happen at all. While it is not wrong to do so, spending an excessive amount of time worrying about the future or feeling resentful about things that had happened in the past is not helpful, especially if it interferes with how we are functioning at present or if it causes significant distress to us. It is important to remember that the here and now, the present, is where we can live and make changes in line with what matters to us. Research has shown that being present can help individuals who are struggling physically and emotionally by reducing the stress and decrease its impact on their well-being, as well as improve their ability to cope with negative emotions such as fear, stress, and anger. In ACT, the concept of being present is the process of becoming attuned to what is occurring right now, in the present moment, by observing your thoughts and feelings without judging them or trying to change them. These are 3 coping strategies that I will cover today that can help us stay present. The 5 senses of mindfulness is using our sight, hearing, touch, taste, and smell as a way to anchor our attention and to help us be aware of our present moment. Sight involves observing the visual aspects of your surroundings without getting caught up in judgments or distractions. You might notice colors, shapes, movements, and any other details. You can practice this by focusing on a specific object or by appreciating the overall visual experience around you. Hearing entails fully listening to sounds without trying to label or interpret them. What can you hear around you? This includes both close and distant sounds, as well as silence. Touch is by bringing your attention to the sensation of your skin being in contact with something around you. For example, your thighs against the chair, your feet on the ground. You may notice pressure or even temperature. Is it warm? Is it cold? Or do you notice any texture? For example, when you're tracing your fingers against your tabletop. Taste is by savoring the experience of eating or drinking without rushing or multitasking. Pay close attention to the flavors, textures, and sensations in your mouth as you eat or drink. Smell is by being attentive to the scents around you. It can be the aroma of food, the fragrance of flowers, or any other environmental smell. So that essentially is the 5 senses of mindfulness. Next, we have breathing exercises, which not only helps anchor your attention to the present moment, but it also promotes relaxation. So if you search online, there are many different guidelines when it comes to breathing exercises. For example, box breathing or even the 4-2-6 guideline. What's important is that when we breathe in through our nose, we hold for a short while, and then we breathe out through our mouth, slow and steady. So if you look at the slide, there is the GIF over there, right? Let's give it a try, okay? So let's breathe in. Let's hold and out. In, hold, out. So you may repeat this as many times as you want. I have some patients who practice this 10 minutes a day, every single day before they start their day, and they find it helpful for them. Lastly, there is meditation. Meditation is a mental practice that involves focusing your attention either on a chosen object or spot in the room, or a word in your head, or even your breath. So it is common if you caught your mind wandering off as you meditate, just remember to gently guide your attention back to present. So cognitive diffusion is another mindfulness exercise that involves distancing yourself from your thoughts so that they have less control over your emotions and behaviors, particularly thoughts that are distressing or not helpful. Cognitive diffusion helps people notice their thoughts and just to take a step back to observe these thoughts. I would like to invite us all to give this practice a quick try. Okay, so let's all sit in a comfortable position, either with your eyes closed, or you can also rest your gaze on a fixed spot in the room. Visualize yourself sitting beside a gently flowing stream with leaves floating along the surface of the water. For the next few minutes, take each thought that enters your mind and place it on a leaf. Let it float by. Do this with each thought, whether they are pleasurable, painful, or neutral. If your thoughts momentarily stop, continue to watch the stream. Allow the stream to flow at its own pace. Do not speed it up or rush the thoughts along. You are allowing the thoughts to come and go at their own pace. If your mind says, I am bored, or I'm not doing this right, place those thoughts on the leaves too and let them pass. If a difficult or painful feeling arises, simply acknowledge it. Say to yourself, I notice myself having a feeling of boredom. Place those thoughts on the leaves and allow them to float along. From time to time, your thoughts may hook you and distract you from being fully present in this exercise. This is normal. As soon as you realize that you have become sidetracked, gently bring your attention back to the visualization exercise. Again, Visualize yourself sitting beside a gently flowing stream with leaves floating along the surface of the water. When you are ready, try to bring your attention away from the stream and back to the room around you, noticing the sounds, the feeling of contact between your thighs to the chair, your feet on the ground. And when you are ready, slowly open your eyes. So there we have it, a very quick try of doing this exercise. You may also search it up on YouTube. There are a few guided videos on leaves on the stream for you to try out as well. So these are the key takeaways of cognitive diffusion under the concept of ACT. So cognitive diffusion is to help us be aware of our thoughts, to just observe the thoughts and not act on it. This is to help us, or rather help reduce the power of the thoughts over us. It's by acknowledging and drawing a distance from the thought, and it is never about getting rid of the thoughts. In ACT, we use the term values to refer to activities that give our lives meaning. So values are not goals in that we can never accomplish a value. Instead, values are like a compass. They help us make choices based on the directions in which we want our lives to go. Values are who we want to be and what we want our lives to be about. The idea here is that when we connect with our values, we are able to move to our lives in a more meaningful direction, even in the face of difficult or painful experiences. Furthermore, values are very individual. They are not based around what others expect of us or what we think we should be doing. We choose our own values because these are things that truly matters to us. So there are several examples of values such as relationship. It can be family relationship, it can be romantic relationship, it can even be friendship. So say for example, if family relationship is important to us, how then do we define family relationship? How do we improve family relationship? How do we maintain family relationship? On the right side of my slide, there is a bullseye worksheet that helps individuals visualize how closely they are living fully in accordance to their values. So if you notice in the center, that bullseye in that center, it represents you living life fully in accordance to your values. And the further you are from that middle circle in the center, it means that you are not living life in accordance to your values. So in this visualization exercise, it helps patients identify how far they from living life in accordance with their values and what they can do to bridge the gap. So once we clarify our values, we help patients move forward into taking important committed actions in their life by translating values into actions. These actions are based on your personal values, and you are intending to move forward towards a more meaningful and fulfilling life, despite any challenging thoughts, feelings, or obstacles that may arise along the way. So we can start translating values into actions by the following in the slide. Using SMART goal, for example, something that's specific, measurable, achievable, relevant, and time specific. So using the family example, it can be visiting my family for lunch on alternate Saturdays every month for about 2 hours. So taking small steps in order to build a habit or a routine as you are working towards living life in accordance to your values. So if you are somebody who does not visit your family often, we can always start off with once a month first and then slowly work your way up. Exploring other actions that can be done to improve or maintain family relationship. For example, it can be like checking in on your family, using reminders to help yourself be reminded that, hey, this is the life that I want to live in accordance to my values, relying on your support system so you don't feel alone in this journey. So I will now hand over the slides to Lynn to talk about the other ways to cope, as well as some resources that she can share with you.
Rather than sitting down and ruminating on unhelpful thoughts, we can think of something that are much more doable to cope. For example, having a routine. We can plan a routine as to when we can take our meals and medication on time. Put time aside for exercise and keeping ourselves meaningfully engaged will help us to control our diabetes better. We can also explore hobbies. Living with diabetes doesn't mean we can't do the things we love. While we will always need to be aware of our blood sugar levels, we can still enjoy hobbies and activities that we enjoy, even for that 15 minutes a day. Activities such as simple walking, spending time with family and friends, watching a movie or TV show, taking a warm bath, meditating or doing some deep breathing. Whatever it is, spend time to do what is enjoyable for you. This will go a long way to help you think positively and live a balanced, healthy life. If you're having a tough time, tell someone. Join a support group or stay connected with others. It is important for your mental well-being. Reaching out to your family, friends, or colleagues to talk about problems can help lessen the burden instead of keeping inside you and dealing on your own. When we are recording our blood glucose level, we can try to add an additional column to record our stress level. This can give us an indication if the stress has any effect on our blood sugar level. If we do, try mindfulness that Hui Ting has taught us today. If your issues are getting too much to handle, speak to a professional or even your medical team to avoid being overwhelmed. When you are living with diabetes, it's normal to go through periods of time where you don't feel like everything is going right. It takes a lot of work to properly care for your diabetes, and this can lead to burnout and negative thinking. Some days are better than others, but if you ever catch yourself thinking negatively, try to reframe those thoughts and see the good in every situation. Here are some examples from negative thoughts to positive thoughts exercise. I can't do this anymore. 2. I am strong. I can do this. I ate so much cake and soda at the party today. I've blown it again. 2. Okay, so I don't really quite follow my eating plans today, but I eat so much better than I used to. I can get back on track again at my next meal. I'm tired of fighting diabetes. 2. I'm working to live my full, best possible life. This type of mental exercise is called positive self-talk, which is having an internal monologue going in your head, where you look at the bright side of things and focus more on the good parts of the situation rather than the bad. This isn't something that we can do it easily. It takes time, effort, and a lot of practice to change our way of thinking. So, start slow and take baby steps. You'll notice progression. Don't beat yourself up for not being perfect. Positive self-talk can have an amazing effect on our perspective. Living with a chronic illness, such as diabetes, can be emotionally challenging for both the person affected and their loved ones. It is important for the caregivers to provide emotional support and understanding to help the loved ones to cope with stresses and challenges. Here are some tips. Be an active listener. When your loved one is feeling overwhelmed or upset, it is important to listen attentively and try to understand from their perspective. Avoid interrupting or offering solutions too quickly. Instead, try to validate their feelings by acknowledging their emotions. Offer emotional support. Show your loved one that you are there for them and you care for their well-being. Offer words of encouragement and support. Try to be optimistic and positive. You can also offer practical support, such as helping with tasks or running errands. Accompanying them for their medical appointments is a great way to show support too. As a caregiver, you can help your loved one communicate with the healthcare team by asking questions, taking notes, and sharing information about their health and lifestyle. In summary, we need to be self-aware of our stresses, can even try out the different type of therapies taught by Hui Ting today to better manage our thoughts and coping. Should you need someone to talk to better managing your diabetes, please do not hesitate to talk to your friendly healthcare team. Last but not least, thank you for joining us today. We wish you best of health always.
Thank you, Lynn and Hui Ting, for the insightful talk. I hope that you have benefited from their sharing on ways to cope when you feel overwhelmed. Now, let us hear from our nurses and pharmacists who will share more on the management of diabetes when you are sick and ways to manage your diabetes medications.
Happy World Diabetes Day. My name is NG, a diabetes nurse educator from Yishun Health. It is my pleasure to share some tips on diabetes and sick day management today. After this webinar, you will be able to understand what is a sick day, how can a sick day affect blood glucose level in people with diabetes, how to manage diabetes during a sick day, and most importantly, when to seek medical attention. A sick day is when you have fallen unwell. Like everyone, people with diabetes can get sick, even we try our best to prevent it. It can be minor condition such as common flu or serious condition such as pneumonia. This is Daniel, who has type 2 diabetes and taking oral medication for his glucose control. He is currently having fever and runny nose, took full medication and cough mixture prescribed by his doctor. He is also having poor appetite and feels tired easily. So how should Daniel and his caregiver manage his diabetes during a sick day? For people living with diabetes, it is important to learn how to manage diabetes during sick day, as the sugar or glucose level can be difficult to control. It is a good practice for Daniel and his caregiver to discuss with the healthcare team and come up with a sick day plan in advance. In people with diabetes, blood sugar level, or BGL in short, may raise and fall because of a sick day. Stress hormones such as cortisol and adrenaline may increase, causing the liver to release stored glucose. Due to this reason, Daniel is advised to continue his glucose-lowering medication to prevent high BGL or hyperglycemia. On the other hand, low BGL or hypoglycemia can happen when his appetite is poor. Therefore, it is important to self-monitor BGL during a sick day. Using a glucometer can help to assess the BGL at a point of testing and detect hyperglycemia and hypoglycemia. BGL pattern can also reflect how different food, activities, and diabetes treatment affect the diabetes control. Caregiver may need to help with the monitoring of BGL when a person is too sick. It is recommended to check BGL 3 to 4 times a day during sick day. You may monitor more closely if you cannot follow regular meal timings or feel really unwell. BGL range may vary from person to person. See a doctor promptly if there's persistent hypoglycemia or hyperglycemia, especially if you see LO, which means less than 0.6 millimole per liter, or HI, which means more than 33.3 millimole per liter in your glucometer. During sick day, it is important to keep ourselves hydrated. To prevent dehydration, drink about 100 ml of sugar-free fluids per hour if you are not on fluid restriction. Try to avoid caffeinated beverages such as coffee, tea, and soft drinks. Look out for symptoms of dehydration like giddiness upon standing up, little or no urine output at all. See a doctor promptly if you are dehydrated or unable to retain food or fluids. For people with diabetes during sick day, it is important for the body to get enough energy from food. To prevent hypoglycemia, follow usual meal plan and eat regularly. However, if appetite is poor and unable to tolerate solid food, try to replace carbohydrate intake with fluid or food that are easier to consume. Carbohydrate requirements per day is calculated based on age, gender, body weight, and may differ based on individual medical condition and diabetes control. The following estimations only serve as a guide. For example, a person who requires 1,002 calories daily can have 30 to 45 grams of carbohydrates for every meal, with an option of 15 grams of carbohydrate as a snack. Do discuss with healthcare team about your daily carbohydrate requirement. Here are some examples of food and drinks. Each of them contain 50 grams of carbohydrate. Let me show you an example of how to replace carbohydrate in a meal during a sick day. To replace a meal that contains 45 grams of carbohydrate, you can use 3 tablespoons of oatmeal plus 4 teaspoons of cocoa powder and add 1 cup of non-flavored low-fat milk. A cup of soy milk or half a cup of fruit juice can be one of the options for 15 grams of snack. Do see a doctor promptly if one is unable to retain food and fluids. People with diabetes may continue oral medications and insulin if able to eat and drink well. But there are certain circumstances where diabetes medication may need to be adjusted during a sick day. Do discuss with the doctor in advance. Hypoglycemia refers to PGL of less than 4 millimole per liter. The early symptoms include having hunger pangs, tremors, cold sweat, fast heartbeat, feeling lightheaded or headaches. A person with severe symptoms can be disorientated and aggressive, has difficulty talking or unable to concentrate, may experience blurred vision or feel like fainting too. The close one should be vigilant and know how to rescue a person from severe hypoglycemia. If action is not taken, a person with repeated hypoglycemia may lose ability to detect the symptoms and eventually lose consciousness. Self-monitoring of blood glucose can detect hypoglycemia and prevent it from happening. It is important to follow the hypoglycemia action plan when the BGL is lesser than 4 millimole per liter, even if there's no symptoms. To treat hypoglycemia, take 15 grams of fast-acting glucose as soon as possible. Drink half a can of soft drinks, but must make sure that it's not sugar-free. Some soft drink may contain less sugar. Hence, it is important to read the label before using it as a hypoglycemia correction. Other options are half a glass of fruit juice, 3 soft sweets, 3 teaspoons of sugar, honey, or glucose powder. Recheck BGL again 15 minutes later. Repeat the treatment if it's still less than 4 millimole per liter. Seek medical advice if the BGL remains less than 4 despite repeated treatments. Call an ambulance immediately if a person becomes unconscious or unable to take anything orally. Take a longer acting carbo like bread or biscuit if the BGL is more than 4. It is important to prevent the BGL from dropping again. Do not use chocolates or other food that contains fats or fiber for hypoglycemia correction, as they do not raise BGL fast enough. Hyperglycemia is the term to use to describe BGL more than 15 millimole per liter. The common symptoms include increased thirst, frequent urination, and fatigue. Unfortunately, most people with diabetes do not experience these symptoms until their BGL is very high. The key points to prevent hyperglycemia are to take your diabetes medication regularly, be mindful with carbohydrate intake, and hydrate regularly. Persistently high BGL may result in accumulation of blood ketone in the body and eventually leads to diabetes emergencies such as diabetes ketoacidosis or hyperosmolar hyperglycemic syndrome. The person may be extremely thirsty and needs to urinate more frequently, feeling drowsy, experiencing nausea and vomiting, complaining of persistent abdominal pain, or difficulty breathing. Some has this fruity odor breath and can become confused. These are life-threatening conditions that need to consult a doctor immediately. In summary, people with diabetes must always be prepared in case they are down with illness. Remember to follow the SICK rules, no matter how minor the illness is. S is for sugar monitoring, every 4 to 6 hours or even more frequently if necessary. I reminds people on diabetes treatment not to miss their insulin injection or oral diabetes medication unless advised by the healthcare team. C shows the importance of eating small regular meals portion as tolerated, and also not forgetting to drink sufficient fluid if it's not contraindicated. K warns us about the possibility of high ketone, which is the sign of diabetes complication, and the importance to seek treatment immediately. Consult your doctor if you are unsure. Do not hesitate to seek medical attention if your BGL is observed to be out of the usual expected range, especially with repeated episodes of hypoglycemia, or if your glucometer shows HI. Always consult a doctor if a person with diabetes is experiencing signs of dehydration or even feeling extremely unwell. Seek immediate treatment if DKA or HHS is suspected. Notify the healthcare team if the diabetes medication have been self-adjusted. With this, I will end my sharing. Thank you and see you later at the Q&A session.
Good morning, everyone. My name is Fang Fang, a pharmacist from Woodlands Health. For World Diabetes Day this year, our team of pharmacists would like to share with you how we can care for our loved ones with diabetes by caring for their medications and understanding how to take and use them safely. To start off, meet Mr. DM, one of our patients who comes to collect his diabetes medications every few months at the pharmacy. Like many of our loved ones, Mr. DM is taking some long-term medications, one of which is a round, white tablet for diabetes. You may have noticed that your family members are taking many different tablets at home, and that many of these tablets are round and white. It's important to know that while they look similar, they may be different medications that serve different purposes. How can we tell these medications apart? While it's convenient to recognize the medicines by their color, size, or shape of the tablet, this can get confusing, especially if you and your loved ones are taking many medications that look similar. Instead, take a look at the medication label, strip, or box when you first receive it from the pharmacy. The medication name, as well as the medication strength, which tells us how much of the medication is in each tablet, will be stated on the medication strip, label, or the box. For example, the first picture on the left shows a packet of metformin 850 mg tablet, where the name of the medication is metformin and the strength of the medication is 850 mg. The second picture shows a box of linagliptin 5 mg tablets, where the name of the medication is linagliptin and the strength of the medicine is 5 mg. Some medication labels, strips, or boxes may also indicate both the ingredient name as well as the brand name of the medication. In this case, the ingredient name of the medicine is linagliptin, while the brand name is Tridenta. Now that we have learned how to read the names of our medications, you may be wondering, how do I know how to take them? The instructions for how to take your medications can easily be found on the medication labels. It is a good habit to read your medication labels every time before you take your medications so that we take them correctly for our safety. This is an example of a typical medication label. The top section of the label will state the name, the strength, and formulation of the medication. Below this will be instructions on how to take them correctly. So for example, take 1 tablet 3 times a day with food. This would mean that this medication should be taken in the morning, afternoon, and evening with our 3 meals a day. There may also be additional instructions to guide us, which include food or drinks to avoid while taking our medications, and also whether to take the medicine before or after food. It is important to take note of the timing of our medications with respect to meal times, as some medications may be specially timed to reduce our risk of side effects and help us tolerate our medications better. Here are 2 examples of metformin and glipizide, which are 2 different medications to control our blood sugar. Metformin should be taken with or after food to reduce stomach discomfort, nausea, or diarrhea, whereas glipizide should be taken before food to reduce the risk of low blood sugar. Next, let us share some tips on how we can better identify our medications. You may have noticed that the packaging of our medicines may change from time to time. This can happen when the pharmacy changes the brand of the medications that they supply. For example, both the medication package shown here contains metformin 850 mg tablets, but while they are the same medications, their packaging looks different as they are of different brands. In order to ensure that you do not take duplicated medications, always check the medicine name and medicine strength stated on the medicines, especially when you receive them and medications that look new to you for the first time. Next, some medications may have many different strengths, so an example here would be metformin. Metformin comes in 250 mg, 500 mg, and 850 mg tablets, and while all 3 of these medications are metformin, the amount of metformin in each of these tablets is different. Always pay attention to the medication strength to ensure that you are taking the right amount of medication as advised by your doctor. In addition, some medications may have different formulations as well. On the left, we have the metformin 500 mg tablet, and on the right, we have the metformin XR 500 mg tablet. Both tablets have the same ingredient, metformin, but they work slightly differently in the body and hence should not be taken interchangeably without your doctor's instructions. The XR in metformin XR stands for extended release formulation, which means that the medication is slowly released and absorbed into the body over time. This helps the medicine last longer in our body and also reduce the risk of side effects such as stomach discomfort. It's important to note that such specially formulated tablets should not be half or crushed without our doctor's or pharmacist's instructions, as they may lose their extended release effects. Now that we have understood more about identifying our medications, how can we ensure that we keep them safely? You may have wondered where you can find the expiry dates of your medications. The date is usually printed on one end of the medication strip or box, and it's good practice to keep track of the expiry dates of your medications so that we can refill our medicines before they expire. Always discard expired medicines for your safety, as they may no longer be effective and may instead cause harm to our body. Storage of our medicines is also an important part of keeping them safe for our use. Most medicines can be kept at room temperature in a cool and dry place, and avoid placing medicines in areas with direct sunlight or contact with heat, as this could affect the quality and safety of our medicines. Instructions for medicines that need to be stored in the fridge will typically be written on the medication label. Your pharmacist will inform you if these medications have to be refrigerated, and you may receive them with a fridge sticker pasted on the medications to remind you. It is recommended to store these medicines in the general storage area in your fridge and not in the freezer. After learning about the oral forms of medications, Mr. DM has some questions regarding his insulins as well. Let us now move on to know more about insulin's injections, which comes in different forms and types, each having properties that are unique to its own. There are mainly three categories of insulin injections, known as the basal insulin, our mealtime insulins, and premixed insulin, which is a combination of our basal and prandial insulins. I'll be sharing more about their differences in the next slide. Within each category, insulin preparations can also come in various formulations, such as insulin vials, pens, or pen fills. Depending on your needs and preferences, your healthcare provider will be able to select the most appropriate insulin form and type for your care. First, let's recap. Insulin is a hormone in our body that is secreted by the organ pancreas, and this helps to regulate blood sugar in our body. As seen from the graph, the level of insulin release fluctuates and is largely affected by our blood sugar level at any point of time. Basal insulin, as represented by the blue dotted line on the graph, is the baseline insulin needed to keep our blood glucose level stable throughout the entire day, and it targets our fasting blood sugar level. On the other hand, mealtime insulin, as represented by the orange dotted line on the graph, mimics our natural insulin production in response to sugar spikes after we eat, and mealtime insulin is required to control post-meal sugar spikes, as they have a faster onset and last for a shorter period of time as compared to our basal insulins. This is an example of a typical medication label for insulins. The top section of the medication label will state the name and preparation form of the insulin, following which is the instruction on the insulin dosage and timing of the injection. And lastly, additional instructions that are unique to each insulin, for example, the discard duration after opening, the storage condition, as well as the timing of injection with respect to food. Although insulin pens, vials, or pen fills can be differentiated by their colors, it can get complicated when our doctors try to individualize a regimen to suit our lifestyle. So it's important to still identify our insulins by their names. Here are some examples of the insulins that are often prescribed. So basal insulins can be injected regardless of food intake, as the profile of the insulin is usually flat without any peaks. Mealtime and premixed insulin, on the other hand, peak significantly 1 to 2 hours after injection. Therefore, it is important to match the time of injection either immediately before meals to 30 minutes before meals, depending on the specific type of insulin. And to skip the injection if you are planning to skip your meal to avoid low blood sugar episodes. Here are some examples to illustrate the importance of reading the additional instructions on medication labels and to look out for the appropriate timing of injections with respect to meal times or food intake. In this case, Novorapid should be injected immediately before food, while Insulatard needs to be injected 30 minutes before food. Moving on, let us now learn how to store your insulin properly. Storage conditions of almost all insulin preparations are similar, so unopened insulins need to be kept in the fridge, and once opened, it should be stored in a cool, dry place away from direct sunlight or heat sources. Insulins are temperature sensitive, and when exposed to heat or subjected to frequent changes in temperature, the stability of insulin may be affected, resulting in potential loss of effectiveness. In addition, injecting insulins that are at room temperature will be less painful and uncomfortable as compared to injecting cold insulins from the fridge. Now that we know how and where insulins need to be kept, the next question to ponder about will be the validity of our insulins. Can insulins be used indefinitely as long as it is kept properly? So the answer is no. Similar to that of perishables and all other medications, insulin preparations have expiry dates tied to them to ensure safe and effective use. As mentioned previously, insulins are sensitive to temperature, so once opened, the expiry will be shortened to about 4 to 6 weeks from the date of opening. As such, it's important to write down the date of opening and to read the additional information printed on the medication label to know when exactly the in-use insulin needs to be discarded. On the other hand, for unopened insulin, if stored properly in the fridge, they are good for use till the expiry date that is printed on the packaging. Looking at these two types of insulins and the instructions on their medication labels, we can see that they have different expiry dates after opening. If we were to open these two insulin pens today, NovoRapid pen that has a shorter expiry of 4 weeks will need to be discarded earlier than the Levemir pen, which can remain stable for 6 weeks. Now let's look at two common issues faced during insulin administration and learn how to troubleshoot them. One of the more common feedback from patients will be pain, bruising, or bleeding experienced after their insulin injections. This could be a result of wrong insulin technique, so please note that insulin needles and syringes should always be for single use, and this means that you should always use a new one for each injection. Reusing needles or syringes may result in the higher risk of infection, pain as the needle tip dulls, and subsequent inaccurate doses as reused needles can leak insulin or allow air into the cartridge. Another issue frequently faced is the formation of hard lumps at the areas of insulin injections. We call this lipohypertrophy, and this can happen when insulin is repeatedly injected at the same place, leading to build-up of fatty tissues under the skin. Hence, regular rotation of insulin injection sites is important to prevent this, and you may consider splitting your abdomen into 4 quadrants, as shown in the picture, and using 1 quadrant per week, moving from one quadrant to another in a consistent direction. So remember to inject at least 1 to 2 fingers away from your previous injection site. If you already have existing hard lumps, you should avoid injecting in these affected areas, as insulin absorption can be erratic. So let these areas rest until the tissue returns to normal, and take note this may even take months. Okay, moving on, being asked if you have been compliant to taking your daily medications is probably the question that your healthcare provider would ask at each clinic visit. Some of the common reasons cited by patients for not taking medications include, firstly, having a busy lifestyle with irregular meal timings. So patients who do not have the habit of bringing their medicines out with them at all times would tend to forget and miss their dose. Secondly, forgetfulness, especially so in our elderly patients who manage their own medications. With unforeseen distractions, patients may not remember whether they have taken their medications. Thirdly, experiencing adverse reactions after starting new medications often result in patients stopping the medicine. Let us now find out how we can tackle these issues using the following solutions. Firstly, setting daily reminders or alarms in our phones can be helpful for patients who have a busy schedule to remind them about taking their medicines and meals. Secondly, for patients who have difficulties remembering whether they have taken their medications, checking off the calendar after taking a dose can help avoid situations where they become unsure and skip a dose of medicine unintentionally. Thirdly, if adverse reactions arise, instead of stopping the medication on your own, you should try to call and speak to the healthcare provider or bring forward your appointment. The healthcare team would be able to assess and advise if the discomfort is related to the new medicine, and they may be able to provide alternative medicines if required. Fourthly, placing the medicines at areas where it is visible to you may serve as a physical cue to taking your daily medicines. Some examples include the dining table or coffee table in the living room, or even the side table in your bedroom, if the dose is meant to be taken at bedtime. Lastly, consider getting a set of pill boxes that is suitable for your medication regimen to help better organize your medicines. Some advantages of using a pill box will include the convenience in bringing them out with you whenever you go, and this allows you to take your medicines on the go with the meals. Packing the medication into the pill box for the following week in advance may also help to save some time off your daily routine. And pill boxes may also help us track our compliance to medicines and shows us if there's any particular time or day of the week that we tend to miss our medications. Also, most importantly, family members can play a part in managing medicines by pre-packing our medicines. This can definitely come in handy for caregivers to stay apart from the patient. And do come down to our booth on 4th of November to find out more about managing medications via pill boxes and have a hands-on experience at packing the medications into pill boxes. After going through various ways to improve medication compliance, at this point, Mr. DM has one more question. So why am I having more low blood sugar episodes recently? You may experience low blood sugar episodes if there are changes to your lifestyle and your health. This could change how your body reacts to your medications. So for example, you may be at higher risk of having low blood sugar if the following scenarios on the slide applies to you. Having a poor appetite, skipping or delaying meals, drinking excessive alcohol, exercising more than usual, taking a wrong dose of medications or taking them at the wrong timing, or if you have worsening kidney or liver function. It's important to remember that low blood sugar can happen to anyone. So here is how we can prevent low blood sugar episodes for ourselves and our loved ones. You should check your blood sugar regularly and record the readings down. And this can help you better understand how your diet and lifestyle affect your blood sugar at home. You should also check your blood sugar more frequently when you are unwell or when your appetite is poor. And other than consistent checking of blood sugar, it is important to follow up with your doctor regularly as well so that they may adjust your medications as your condition changes. In addition, you should discuss changes you are planning to make to your diet and lifestyle with your doctor beforehand. This includes plans to fast for Ramadan. If you're unsure regarding medication instructions, always clarify with your doctor or pharmacist and ensure that you know the correct dose and timing to take your medicines. If you have low blood sugar, take note of your low blood sugar reading, the time of the day your symptoms happen, and also how frequently you get them, as this can help your doctor adjust your medicines to keep you safe. To conclude, by understanding how our medications work and how to take them safely and correctly, as well as being compliant to them, we are hopefully one step closer to having better control of our chronic diseases. So do let your healthcare provider know if you are facing any difficulties or if you have any questions regarding your medications. Thank you.
Thank you all for the encouraging and enlightening presentations. For our Q&A session today, we have our panelists consisting of our endocrinologist, Dr. Melvin Lee, our medical social worker, Ms. Lin Huang, our nurse, Sister NG Tang, and pharmacist, Ms. Ao Fang Fang, to help us answer your questions that you have filled in the registration form. Similar to last week's session, we will try our best to answer your questions in this short 30 minutes of Q&A. For questions that we are unable to answer, fret not, do visit our physical exhibition booth on the 4th of November 2023 at Toa Payoh South Community Club from 9 a.m. to 1 p.m. for more in-depth discussion with our healthcare professionals for your queries. Without further ado, let's delve into the first question for our endocrinologist, Dr. Lee. Dr. Lee, we have a question on diabetes diagnosis. So the question goes like this. How could someone find out whether he or she have diabetes if that person does not have any symptoms of diabetes?
So thank you, Moses, for the question. So actually, quite a few of our patients are actually asymptomatic at diagnosis. So actually, diagnosis often is done through screening blood tests. So the Ministry of Health actually advocates for patients over the age of 40 to be screened for diabetes. However, you have like risk factors such as family history of diabetes, pre-existing hypertension or high cholesterol, or obesity, then you should be screened earlier regardless of age.
Mm-hmm. And after a person were to be diagnosed with diabetes, how often would the follow-ups be?
Yeah, so this depends on a few factors. For patients who have their diabetes that's well controlled, taking their medications regularly, there's a good response. They can be seen maybe every 4 to 6 months. But for patients whose diabetes are suboptimally controlled or there are complications, then we'll have to see them more regularly at closer intervals, and this will be decided by the doctor and care team.
Thank you. The next question, I guess, will be directed to our Sister NG. Sister NG, there is a question on planning for blood tests. If my loved ones are planning for a fasting blood test, Is there anything else that I could help to prepare them for it?
Thank you for the question. The requirement for fasting blood test is no food and drinks for at least 8 hours. Only plain water is allowed. So if your loved ones are on oral anti-diabetic medication or insulin injections that can lower the blood sugar level, you can advise them to take them after blood tests are done. Taking them before the blood test may result in low blood glucose level or hypoglycemia. It is also good to consult your healthcare workers on this. I hope this answers your question.
Yes, definitely. You mentioned about hypoglycemia. So another participant also asked about, hypoglycemia. She mentioned that, she detected family members having hypoglycemia during sleep on finger prick readings. Should she wake him up to drink milk or to allow him to sleep through?
This is a very good question. And yes, you should wake your loved one from sleep to check if he's conscious and should not allow him to sleep through. If he's able to respond and alert enough, hypoglycemia treatment should be given. Milk is not recommended because it contains fats and protein, which may slow down the absorption of glucose. What you need is to treat your loved one with 15 grams of fast-acting sugar. For example, 3 teaspoons of honey or half a glass of fruit juice. However, if your loved one is unconscious, call 995 ambulance immediately. Thank
Thank
you.
you, sister. Yeah. Thank you for allowing us to have a better understanding of how to treat hypoglycemia. Now let's move on to the next question. So some of our participants have also written in to us about how to manage their emotional struggles in the face of diabetes. And there was one participant who wrote about the fact that he or she has to work long hours and needed to juggle their parenting duties after work. How can he or she juggle her roles and duties in order to control her diabetes? So can we invite our medical social worker, Lynn, to take this question?
Thanks, Dr. Moses and the participant for the question. It's definitely not easy to balance work, family, and diabetes together. So there are a few ways I can think of right now. First is to set realistic and attainable goals each day. This can help you feel less overwhelmed and more in control. Second is to create routines. You can try to plan and schedule your time as much as possible. Do fit in pockets of time to exercise. To start off, you can try to go for a 15 minutes walk during lunchtime or 20 minutes at the playground with your children after work or even the weekends. The other thing that you can do is to involve your children and family in your routines. You can try to go for walks together or do grocery shopping and cook healthy meals together. Third, you may also try to do meal preparation on non-work days. Cook in batches and freeze meals for your family or even yourself. This will enable to better control your time with your family, and at the same time, you can take care of your diets too. Next, we all know that self-care is something very important and it improves your mental well-being. So treat yourself something nice, do something that you like or which help you to relax, such as going for shopping or even a massage. Lastly, you may also want to consider practice gratitude. Set 5 minutes every night to think about the good things that happen in the day. You can write it down or journal it down, and this practice will help to foster positivity. And if you are a family member who have a loved one with diabetes, you can consider supporting them in this way too.
Thank you, Lynn. You mentioned about creating routines. There is a question on how sustainable these routines are in improving diet and exercise. So do you have any tips for our participants?
I must say kudos for taking the first step. So writing down what you have achieved, can keep track of your progress, and act as a form of self-encouragement when you look back on how much you have done, right? And you can also consider sharing this resolution and plans with your loved one or friend who can encourage you to stay committed. So it will be a plus if this person can join in this routine too. So can consider taking baby steps to make it easier to sustain. For example, when you're taking a bus, alight at a stop earlier and walk home. You can also consider pacing your exercise goal, like starting a 15-minute daily workout before increasing the frequency and the intensity according to your preference and comfort level. And the other thing I can think is to incorporate mini rewards as a reinforcement at the start of the journey. For example, 10 minutes of doing something you enjoy after you met your goals. So remember, every step counts.
Those are very good. Yeah, those are very good suggestions, I must say. There is also another question about, self-care. There was one participant who felt anxious whenever she measures her blood sugar. So do you have any coping strategies that she could use to cope with that anxiety?
Okay, I can understand that maintaining your blood sugar level at the target range all the time is never easy. So it's normal for us to feel anxious and the feeling of helpless. So you can try to consider taking small steps such as lowering your blood sugar reading, HbA1c, by 1%, instead of focusing on achieving the target goal all at once. So know that you are headed in the same direction of improving your health. You will have more successes along the way. Don't be too hard on yourself. Learn how to celebrate small wins. So at times, when the blood sugar reading is high, do not be discouraged. Tell yourself that the number is just a number at the point of time and it can change. Think about what the number is teaching you, that perhaps what you have just ate or what you have just drank might not be suitable for you. So you can take a note on how that food makes you feel. For example, increased fatigue. And you can try to discuss with your healthcare professionals if this food item or drink is suitable for your diet and if there's better alternative. So you can always explore with your doctor's nurse on how you can better manage your blood sugar and create a plan together. So another way to cope is to practice mindfulness. It means to be aware of your present moment, your feelings, thoughts, and the environment. Instead of worrying about the past or feeling anxious about the future, you focus on the here and now. It helps you to clear your mental clutter and creates a distance from your thoughts so that you can view them from a new perspective. And this can help you to reduce your anxiety and boost your mental wellness.
Thanks, Lynn. And a lot of our participants are also caregivers of patients with diabetes, and we would also like to use this opportunity to reach out and provide information to our caregivers as well. So next question will be, sometimes caregivers face the challenge of loved ones, not being willing to control diabetes. How could you encourage your loved ones to control their diabetes? And what could you do as a caregiver?
Dr. Moses, yes, this is quite a common question that we receive from caregivers. So I will suggest that the caregiver to take time to understand your loved one, as they might be facing difficulty coping with their conditions. You can also explore the reasons affecting their willingness to take their medication or follow the treatment plans. So Be the source of encouragement to your loved one. For example, doing things together, preparing healthier food options, and exercising together. It is important for the caregivers to show care and concern during their loved one journey. You can start off by attending the medical appointments with them, or even those caregivers who are staying apart, you can always check in to find out how they are coping. I will also suggest that the caregiver to set attainable goals with your loved one and try to incorporate it in their daily routine. With this, they might be more receptive towards these goals instead of making big changes at one go.
Thank you, Lynn. Another common question that we face in the registration form is about the issue of medications. So some participants actually ask whether there are medications without any side effects, especially for the elderly. Perhaps we can direct this question to our pharmacist, Fang Fang, to answer.
Thank you for the question. So elderly patients are more susceptible to experiencing side effects from medications. And the main side effect we worry with diabetes medicines would be low blood sugar. However, to reassure everyone, actually our doctors and prescribers are all aware of this, and we'll keep this in mind when they are tailoring medication regimens to each patient's needs. So in general, the use of medications that may have higher risks of causing low blood sugar will be reviewed and avoided in the elderly population. I would also recommend for everyone to speak with your doctor or pharmacist if you are worried that a certain medication is causing certain side effects. Thank you. I hope this answers your question.
Thanks. I think our caregivers are also concerned whether these medications could be reduced. Do you have any thoughts on this?
Yeah, again, thanks for the question. So, I mean, good control of diabetes is important in preventing future complications. I think we should all keep in mind that everyone is unique, as each of us actually consume different types and amounts of food, have varying levels of physical activity, and also have different health conditions as well. So actually all of this will need to be considered before we can start to simplify our medication regimen, still with the aim of maintaining good diabetes control. So in general, to answer the question, yes, it may be possible for medications to be reduced once diabetes is well controlled, or if someone is experiencing certain side effects from medication. Thank you.
Thanks. And on the topic of insulin, which is also another medication that we prescribe for patients that require them, is it true that insulin would harm the kidney and leads to failure?
Okay, so this is also actually a common question that I hear from my patients as well. I will just take the chance to clarify that insulin does not cause kidney failure. It's actually diabetes that has not been properly controlled for a long time. They may cause damage to the tiny blood vessels of our kidneys that eventually lead to kidney failure. So in fact, insulin may be a protective measure for patients with poorly controlled diabetes as a aim to help achieve good glycemic control and also delay onset of complications to our important organs, for example, our kidneys, our eyes, our nerves, and our heart as well. Thank you.
Thanks, Fang Fang, for clearing up the air on insulin. Then we can move on to the next question on the injection technique for insulin. So there's a question on how someone, caregiver, could assist his or her loved ones to inject insulin. Could I invite Sister NG to answer the question?
Hi, thank you for the question. Earlier on, pharmacist Fang Fang has shared some useful tips on insulin injection. It may sound like advertisement, but you can make an appointment with a diabetes nurse educator to go through with you on the insulin injection technique. But I would like to highlight a couple of points. So the first one is it is recommended to use a shorter needles to reduce pain and also to avoid injecting into the muscle, as this may result in hypoglycemia. The second point is you can also advise your loved ones to use a new needle for every injection. Remind them to rotate the injection sites to prevent these lumps from forming under the skin. This may affect the insulin absorption as well. I hope that answered the question.
Yes, it definitely did. Another common question that I encounter in my practice would be that sometimes my patients tell me that the loved ones miss a dose of insulin or medications. What should the caregiver do in this instance? Perhaps we can go back to Fang Fang to answer this question.
Okay. So generally, if you do miss a dose of your medication, you can take it as soon as possible unless it's close to the time of your next dose. However, there are some exceptions to this. So for certain other medicines, like either oral medicines or insulins that are meant to be taken before meals, for these medicines, you should not take them after meals when missed. So in these cases, do not take the missed dose and also do not double the next one. Just go back to the regular dosing schedule for these medicines. Yeah, I hope that answers your question. Thank you.
Thanks, Fang Fang. I think we have come to the last question. The last question will be directed back to Dr. Lee. So it's a question on blood donation. Can patients with diabetes donate blood?
So this is an interesting question. Actually, patients with diabetes can still donate blood as long as their condition is well controlled. Every time you go and donate blood, there'll be a medical screening actually done by the blood bank. Yeah. So, but for patients with recent adjustments in their medications, dosages, you will have to wait for about 4 to 6 weeks before donating blood. For like more details, there's actually a detailed advisory on the HSA website on blood donation.
Thank you, Dr. Lee, as well as our panelists for today's session. And we have now come to the end of our Q&A. And we hope that you have greater confidence at managing your diabetes, both your emotional health as well as your loved ones' health. And please kindly scan the QR code to fill in the feedback form after the session. And if you have any further questions that you would like to discuss with us, do come for our exhibition on 4th of November, which is next week, next Saturday, from 9 a.m. to 1 p.m. at Toa Payoh South Community Club. Have a nice weekend, everyone, and see you at the exhibition. Goodbye.